Our next topic is physiology of lactation. And breastfeeding is unquestionably the best method of feeding babies. And I ask patients on their first prenatal visit, how are you planning to feed your baby? And the answer that I'm looking for is breastfeeding. And if they say, I'm not sure, say then, let me encourage you to breastfeed. If you have any questions, let's talk about that. This is the symbol for breastfeeding support, which is used internationally. Let's just briefly review breast anatomy. There are 15 to 20 lobes of the breast, and those are divided into lobules. These lobes are really the milk-producing units. They contain alveoli, which produce some milk. We'll show you a picture of that in just a minute. The ducts are the tubes that carry the milk from the alveoli to the nipples. Most of the breast is composed of adipose tissue. And a woman who has a large breast versus a woman who has a small breast, the difference is in the adipose tissue. And a woman who has very small breasts who says, well, I can't breastfeed. No, that's not true, because the majority of the size of the breast is from adipose tissue. The ligaments which support the breast, and the main ones are Cooper's ligaments, are what give the characteristic shape of the breast. And over time, there is changes which occur as a woman ages and matures. This is an image which shows the lobules of the breast, which are in dark. And you can see the ducts which carry the milk from the lobules, and they converge toward the nipple. And yet most of the breast is really fatty tissue. There are changes which occur with the menstrual cycle, with the hormones. Here you can see the alveoli, the collecting ducts, and here we have the adipose tissue. In terms of lactation, there are significant impacts of the various hormones. In terms of the development of the breast, estrogen at the time of puberty is what results in the growth of the ducts, the nipples, and the adipose. And this is discussed under the Tanner stages, which we talked about under the gynecology. Progesterone stimulates the growth of the lobules and the alveoli. So this is not the ductal system, this is the milk-producing area. Now, after delivery, the prolactin is important for the production of milk. And I should also say that in order for the engorgement to occur, estrogen levels need to drop. And they will drop when the placenta comes out. If there is lack of prolactin, milk will not be produced. The milk, remember, is produced by the alveoli in the lobules. When the baby suckles and stimulates the breast, there is a neural impulse which goes to the posterior pituitary and results in the secretion of oxytocin, which then results in contraction of the smooth muscles in the alveoli and the ejection of the milk. This image looks at the breast in utero at 8 weeks development, and all you have is a mammary bud. At 20 weeks, which is mid-pregnancy, we have a mammary cord. At birth, you can see that there are actually alveoli which are present. And it's not uncommon to see what is called sometimes witch's milk, which is being expressed or secreted through the nipples of newborns. And that is a consequence of the high levels of hormones in the mother. After the hormone levels drop with the removal of the placenta, you can see the prepubertal breast really has no alveolar tissue of any significance at all. With puberty, with the increasing estrogens and progesterone, we have the proliferation of the alveoli and of the lobules, as well as of the ductal system. And look at the significant change which occurs with pregnancy, and particularly in the enhancement of the alveolar growth. because they're going to produce the milk. In women, they will increase the size of their breasts by up to 30%. Now, for some women, they say, wow, finally I've got something to show. But for women who start out with big breasts to begin with, this can become a major source of pain because of the support. Here we have the alveolar unit, and you can see the milk-producing cells, which are around the lumen. This is the arterial blood supply, and this is where the oxytocin will come in, as well as the nutrients which are used to produce milk. When there is suckling and release of oxytocin, it is these myoepithelial cells which surround the alveolus, which causes contraction, expression of milk, which goes into the milk ducts, and off it goes to the nipple. And here we have a pregnant breast which is engorged, and you can see how full it is. All right, so that's the end of lactation.